Here's a medical thing they don't tell you about. Leukemia is a blood cancer. Just like you have breast cancer, colon cancer, brain cancer, leukemia, think of it as a cancer in your blood. And some of the early signs can be not that intuitive. Three of the most prevalent cells that circulate in your blood are white blood cells, platelets, and red blood cells. Leukemia tends to come from white blood cells that are not fully matured, so they're bigger and there's a lot more of them. So if your white blood cells are usually a count of 12 to 16, when someone has leukemia and we look at their labs, they'll have a white count of 100 plus, depending on the type of leukemia. So if these immature white blood cells, the leukemic cells, start to crowd out your bloodstream and your regular functioning cells like your platelets and your red blood cells can't do their job, you start to have symptoms like bleeding really, really bad. The platelets in your body are supposed to take care of any sort of bleeding. So if your platelets can't actually be produced at a regular amount because the bone marrow is being crowded out by these leukemic cells, then your platelets can't stop bleeding. That's why patients will come in and say, hey, I've been having a weird non-stopping bleeding that's coming from my mouth, or I bumped into something and my knees had this insane bruise, which is essentially bleeding that hasn't really gone away and it's been days to weeks. Or women will come in and complain that their period is a lot longer than usual, again, because they cannot stop the bleeding since your platelets are not functioning as well. That's why it's good to be aware of your body and if anything's out of the ordinary to speak to your physician.